Hypertrophic cardiomyopathy is an abnormal thickening of the heart muscle, which can lead to an obstruction of blood getting out of the heart muscle to the rest of the body.
And why is that an issue? Does that cause specific symptoms?
So that can cause symptoms of chest pain, shortness of breath, leg swelling, and fatigue in these patients.
Okay, so if I'm trying to understand it a little bit better and just keeping it simple in my mind, if I think about it like a room, the heart like a room, it's like the walls are getting thicker or coming in. So it can get more crowded in that room. It can be harder to fill that room and also get out of that room. The same way it can be harder to get blood into that room or into the heart and out of the heart. Do I have that right?
Yep, exactly.
So how do we make this diagnosis of hypertrophic cardiomyopathy?
So if you have suspicion for hypertrophic cardiomyopathy, your cardiologist will do a whole host of tests, including an electrocardiogram or an EKG, which looks at the heart's electrical activity, an echocardiogram or an ultrasound of your heart, which helps us to look at the heart function as well as the wall thickness, and notably a cardiac MRI, which really looks into the heart and tells us the exact thickness of the heart.
Okay, so it seems like there's a whole host of tests. But before anyone scrolls away, maybe you can just give us a main takeaway about hypertrophic cardiomyopathy.
So hypertrophic cardiomyopathy is a genetic diagnosis. You get it from your parents and you may pass it on to your kids. And as I mentioned, it's an abnormal thickening of the heart, which can decrease blood flow to the rest of the body. It's seen in about 1 in 200 patients, and there are new treatment strategies which we can offer to help patients feel better as well as hopefully live longer.